Okay, welcome everybody. Good afternoon. Thank you for joining our first learning event of the year. This is our member spotlight on the University of Illinois Health's Volunteer Services team, and the first um, event of the Chicagoland Healthcare Workforce Collaborative of 2026. For anyone who's new to CHWC, I am April Harrington. I'm the project manager of the Chicagoland Healthcare Workforce Collaborative. We are here to unite employers with other industry partners like training providers and workforce development organizations to come together and provide accessibility for unemployed and underemployed populations to enter careers in healthcare, and to meet the evolving needs for talent in the industry. We focus on peer learning through events like this, as well as some research and direct programming. Those all fall under our strategic pillars of local and targeted hiring, bridging the gap between our education providers and our employers, and making sure that we are retaining our talent and offering accessible pathways for advancement. We are an employer-led sector partnership, so we are led by the employers that you see here, 7 of which sit on our steering committee, but we are supported by many more of our strategic partners, including community colleges, workforce organizations, funders, advocates, and others. Welcome to everyone who is joining us here today. And everyone is welcome to our quarterly meetings and to our learning events like this. Oops, I don't know why we aren't showing one picture here, but a quick promotion for our second event of the year and our first in-person event of the year. This is happening this coming Tuesday at 9 a.m. Until 10:30 a.m. at the Chicago Community Trust offices downtown at 33 South State. We are very lucky to be supported by the Civic Committee of Chicago and the Tolman Family Office to work with Burning Glass Institute to conduct a data analysis on the state of the Chicagoland healthcare workforce. This will be a deep dive into which positions have changed over the last 5 years, what we're projecting into the future, where our pipelines are not meeting demand, as well as many other benchmarks that should be an interesting way to inform all of your workforce initiatives and our work as a collaborative. So I hope to see many of you there. I will drop the link into more information into the registration in the chat. We will have a light breakfast provided there as well. All right, so getting into why we are here today. Today, we are giving a spotlight to the University of Illinois Health's Volunteer Services Department, led by Kinga Keilman. UIHealth boasts one of the largest volunteer programs in the state of Illinois, and they have used it as a talent pipeline with over 350 volunteers joining the organization as employees over the last few years through a variety of very impressive initiatives, which I'll let Kinga tell you all about. I'm also happy that we have Pamela and Leslie joining, who are former volunteers who are now on staff with Kinga to share some of their stories and insights. Before I hand it over to them to take over, I'd love to gain a sense of who's in the room, get a little bit of engagement going, and hear from you before we jump into the presentation. So if you haven't already, please introduce yourself in the chat so we know who's here. And I'd love to open the floor for a couple of people to come off camera, come off mute, and just share a little bit about how volunteering might have influenced your career trajectory. I know for myself, I've been working in nonprofits my entire career. That definitely started with a couple of volunteerships. I also had a volunteership that allowed me to see that one particular career pathway was not the one that was right for me. Would anyone else like to just jump in and share a little bit about how volunteering has influenced your own career? Don't be shy.
I'll go. Why not? Hi, everyone. Claire Healy, consultant for workforce development and strategy at UChicago Medicine. I did some volunteering, but then upon graduating college, I did a year of AmeriCorps, which actually got me into workforce development in the first place. So I know that AmeriCorps folks would probably be like, it's not volunteering, but I'm going to count it as volunteering. I know it's technically considered service, but to that extent, I think it was very helpful to just learn more hands-on work in public health. I was a health educator at a family planning clinic and very helpful, you know, very helpful overall. But I think to your point, April, it also helped me realize like, okay, maybe doing direct service on a day-to-day basis isn't always for me. It can be very, taxing or it just requires a lot of time to like decompress. So yeah, very insightful and very grateful for that time.
Thanks so much for sharing, Claire. One or two more people want to share.
I can go. Hi, everybody. Mandy Polonsky, Northwestern Medicine. Nice to see you all. I think we, as Northwestern, often does roll deep in this meeting. Um, Very proud to represent. Yeah, so as volunteering, when I was in college, I had the opportunity to volunteer at the Christopher House, which I think is now in Belmont Cragen, but used to be in Lincoln Park, and I got to tutor teen moms for their GED, and it sort of broke open my worldview. And then I did Teach for America, and it sort of led me down a whole other path than I thought I would be on, because it was a really, really impactful experience for me. So always pro volunteering.
Awesome. Thanks for sharing, Mandy. One more person.
This is Michelle McFarland from Equus Workforce Solutions. I volunteered, and this is before I joined the workforce team. Actually, I think before I even knew about really a public workforce, I volunteered for New Moms, which is located on the west side of Chicago. And that just really impacted me because I come from a household of a single mother and just having the opportunity to then be influenced and just seeing, the highlights, the struggles, and what those moms, go through, and the resources that are available to help them just really impacted me. So that was something that I did a few years ago.
Thanks for sharing, Michelle. I love New Moms. Great
Mhm.
organization. And I think, yeah, we just demonstrated how important volunteering can be to help people find their career path. And with that, I will introduce Kinga Keilman, the leader of the Volunteer Services Department and Workforce Development at UIHealth. You should be able to share your screen, Kinga, unless I should give someone else permission.
Yeah, if Pamela could share, we could
Okay.
take permission. Yeah, thank you.
Pamela, you should be able to do that now.
Thank you.
So I will pass it off to all of you. And for everyone on the call, this is being recorded. I will email these slides and the recording to everyone who registered tomorrow, and it will also be available on our website. So take it away, Kinga.
So hello, everyone. My name is Kinga Keilman. I'm the Senior Director of Volunteer Services, Workforce Development and Clinical Rotations here at UIHealth. I've been in this role for almost 15 years, so it's been a while. And I will tell you a little bit about what we do here and all the initiatives that we are tasked with. So our volunteers, we have a very diverse and dynamic community of over actually 1,000 volunteers. So that was the summer that we've reached that huge milestone, and it's people from all walks of life, as young as 18, all the way to people in their 80s. And we are united by a shared commitment to providing exceptional care and support to our patients and families here at UIHealth. Like I mentioned, in summer of 2025, we've actually reached a department of so many volunteers that we surpassed all the numbers here in Illinois and became the largest volunteer department in Illinois and third in the country. So we are super, super proud of that. At the heart of this program is connection. So we try to foster meaningful relationship, compassionate engagement, and welcoming environment that enhances our patients' experience when they come into the hospital, when visitors are in the hospital visiting their loved ones, and trying to leave that lasting impact on everyone we served. Usually volunteers are the first ones to welcome our patients. So this is the first impression that we have. We have a lot of programs in the hospital as well in the clinics. So if we have someone that is interested in working with children, we can place them in those areas. If we have someone interested in emergency medicine, we can place them in emergency room department, surgical services. We have rehab, we have craniofacial center, we have opportunities for our dental students, dermatology, baby cuddling. We are one of the few hospitals that are actually offering that program. So with that, like April mentioned, sometimes it can solidify the interest of a volunteer in a certain career. And sometimes it can, like in April case, hey, this is actually something that I know I don't want to do, right? So it's very beneficial for our volunteers to actually have that experience. We are happy to write recommendation letters, and we are known all over here in Illinois as well as outside in the other states. Next slide. And I'll pass it over to Ms. Leslie. And if I can mention while Leslie is getting ready, with that we have a lot of opportunities. What happens is that it kind of happened organically, that a lot of our volunteers were because they work so closely with different departments, they actually were hired by a lot of departments. So where else you can get a free trial with your future employees. So sometimes a lot of volunteers in different departments, they did a great job, and then they were offered the position. So that's how actually the workforce development started, and that pipeline started growing. I was able to provide recommendations for volunteers, and also departments within UIHealth, they were reaching out to me, hey, Kinga, do you know someone for this position, and that's how it all started. And Leslie, I think you are ready now.
Yes, sorry, I was having some technical difficulties. But
No.
hi, everyone. My name is Leslie Acosta, and I am the Workforce Development Coordinator here at UIHealth. So a little bit about our mission is that we are committed to fostering a diverse healthcare workforce that reflects the vibrant community served by UIHealth. Through our workforce development program, we empower individuals to explore and secure employment opportunities within our own organization. By collaborating with strategic partners who share our visions, we strengthen our efforts towards achieving lasting, impactful change. Next slide, please. And then a little bit more about our mission is that we do aim to be the gateway to UIHealth hospital system, providing an immersive experience for those pursuing career opportunities and advancement. As a guiding force, we inspire individuals to not only their own success, but to uplifting others. Positioned within the Office of Volunteer Services, we offer a unique perspective, granting access and credentialing across various hospital, clinics, and departments to accelerate participants' growth and professional development.
Hi, everyone.
We can pass it to Pamela.
Thank you. Hi, everyone. I'm Pamela. I am one of the program coordinators here at UIHealth with volunteering services, and I'll be going over our local training programs that we have. So one of the many programs that we offer here are CNA medical assistant and phlebotomy. These programs are offered free of charge to selected UIHealth volunteers and employees as a way of giving back to them. Our participants also gain certifications and experiences. Our main goal is to basically transition our volunteers into hospital employment, but also a long-term career in healthcare. Our future training programs include a surgical tech program that's currently in the works at the moment. Our training program cohorts, since 2025, we have had 105 students complete training. In 2022 to 2023, our partnership with Westside United has allowed us to start our first cohort with 5 phlebotomy students and 10 MAs. And in 2023, we started our first CNA cohort with 20 students. And in 2024 to 2025, our partnership with Good Jobs Challenge, we were able to have 4 cohorts throughout the past year. And if you guys have any questions, feel free to ask them in the chat, and we'll be also answering them as we go. Our partnership with the Good Jobs Challenge supports the regional workforce training systems to establish sectoral partnerships that help and train workers in jobs. Not only that, but we were able to start this CNA the CNA programs and MAs with our TTI Medical Training School that provided the CNA training. It included nursing theory, lab, and clinical experience that was done at UIHealth, CPR training, and preparation to pass the IDPH state exam. And we have had 64 out of 70 students complete their IDPH exam and are employment ready. Out of those students, 24 have found employment and 42% are actively seeking employment opportunities. And then I'll pass it over to Kinga.
So one of the crucial things that we do while choosing our candidates for those trainings, we want to make sure that they are established volunteers, that they put some hours in. And so that's our number one thing that we look at. We also look at where they live. We are interested in the zip codes surrounding here, the hospital, the Westside United zip codes, that those are underserved communities. We just want to make sure that we invest in those communities to kind of help the community. So that's very important to us. And we also look at the financial need of that particular candidate. So we just want to make sure, that's why we're doing this as a token of appreciation for all the services that volunteers are and the efforts that volunteers are putting in. So as you can see, the yellow highlight, we have Westside United zip codes and the 27 ward zip codes. The blue highlighted parts are Westside United zip codes, and then the green ones are the 27 ward zip codes. We will be actually meeting with the aldermen not this Friday, but the next Friday. So we'll be talking about, we'll be presenting our initiatives, the workforce development initiatives. So yes, so the total was 105 students have completed the UIHealth training program. And next slide. And you can see those are the participants, particular the zip codes. We have people from Lincoln Square, and all the dots right here, those are all surrounding our hospital. Those are the 5 important zip codes that we were looking at and making sure that all of our participants for the CNA, MA, phlebotomy cohorts are from those areas. The next slide. And also when it comes to ethnicity, you can see that over 40% that was Hispanic, Latino. We have over 25% of Black African American students, over 20% of Asians, 8% of white, and we have a little bit of everything here. So you can see that we have majority of Black and then Hispanic, Latino, and Brown. So we're super, super proud of it that we're investing in those communities as well to make sure that while they have a better opportunity in life, they will also make sure that the whole family gets better chances at the health insurance and just better the situation that they're in. And next slide. And also, those are the ages of our participants. So between 8 to 20, we had over 30%, 44, it was between 29 and 23, 11%, 24 to 26, 1%, 27 to 30. We had almost 3% participants between 31 and 40, and over 7%, 41 to 50. So as you see, the 80% of the individuals were between 18 and 23-year-old, and then we had all the other ages. So this is how the graph looks in the next slide. And I'll pass it to Ms. Leslie.
Yes. So one of our newest program is Shadow Certified Nursing Assistant. It is designed to give volunteers meaningful exposure to the role of CNAs while rotating between hospital units, such as the ICU, Med-Surg, and Step Down. We are in partnership with UIC Doctor of Nursing Practice DNP project. And we've had 2 cohorts so far, one in fall 2025, where we had 14 participants, and last month for winter 2025, we had 16 participants. So through this program, our volunteers are able to get a glimpse of a day-to-day responsibility of a CNA in healthcare and the healthcare field. They're also able to solidify their interest into the career.
Sometimes we have students that they may think, hi, I really want to be CNA, I really want to be a nurse, and their knowledge of what that position entails is very minimal. So that's why we created this program. So people that they think that they're interested in nursing, they can actually shadow a nurse technician. They can see what day-to-day activities look like. So it's also very important, and it will either solidify their interest. Hey, I actually want to participate in CNA program, or not. Hey, this is not something that I would like to continue. And this way, we kind of the reason behind creating this program was that we want to make sure that we don't want to have someone in the program that in the middle of it, they will figure out this is something that I don't want to do. So we just want to give them that little trial, give them that little shadowing experience to kind of avoid that, because otherwise they take the spot away from someone that could benefit from that. Okay, continue, Leslie. Sorry.
Kinga, can I ask, we have some questions in the chat.
Absolutely.
Would you mind talking a little bit about the broad volunteer composition? Like, how do you recruit these volunteers? Who are they? I think my understanding is they're mostly university students. How long do they have to volunteer to get into these types of special programs? And are there any, required skills or enrollment requirements?
So like I mentioned, we have volunteers from all different walks of life. As long as we have youngest ones are 16, and we have people all the way in their 80s. So those are high school students, those are college students, those are employees who have regular jobs and they still want to give back. Those are retired population that they try to occupy themselves. We have a lot of cuddlers that they are retired, and they come and cuddle babies. So I mean, you name it. I had a pilot that was flying in between from Tennessee that was just having stops in O'Hare, and he was coming to volunteer. We had lawyers, we had sheriffs. I have one police officer that is volunteering with us. I mean, you name it, we have it. To be honest with you, we have, yeah. So it's a very diverse group, to be honest with you, and age-wise and job-wise, occupation-wise, and yeah. So that's that, and we have volunteers that they are volunteering with us for over 10 years. And another thing that I actually opened up when I started this program, one of my first volunteers was on a wheelchair. So prior to me, that was never a thing that we had disabled volunteers volunteering at UIHealth. Now we have volunteers on the wheelchairs. I kind of customize their assignments, and we have volunteers with different disabilities that they're volunteering. This is we partnering with. We will talk about it in a little bit. So doors are wide open to we will just kind of tweak things around, and we'll still find a place for you to volunteer. I don't think, any disability should be, we'll find a way. around it. So when it comes to the requirements, we are requiring 8 hours per month minimum, with a commitment of a year. So someone has to commit to 100 hours, whether, they finish it with the 4 months or a year, 8 hours per month, that's up to them. But that's just the minimum. Like I mentioned, we have relationship with our volunteers that lasts years. Another question was, where do we recruit volunteers from? At this point, I feel majority of it is word of mouth. Volunteers are having a great experience and they share with their colleagues, they share with their family members. We have tons of siblings volunteering together. We have couples volunteering together. We have mothers, daughters volunteering together. So it's a very beautiful thing to see. And how we are recruiting, we are attending a lot of different events, and just sharing the word. But I feel like at this point, it's mostly word of mouth, to be honest with you. Yep. Any other questions? I hope I answer all of them. Leslie, do you want to continue?
Yes. Okay. Moving on, we also have our mentoring educational development program, which it introduces high school students from our partner schools to various hospital departments, giving them early exposure to healthcare careers through volunteer opportunities. So some of the schools that we are in partnership with is Christ the King College Prep, where our students participate in a 1-year program. We are also in partnership with ITW, David Spear Academy, where students participate in an 11-week program.
Just to add one thing. So for the Christ the King College, we are actually investing in the students' future. So by coming here, the school is collecting an amount of money per student, and that will go to their college education. Yeah.
Yes, it is a work study program for Christ the King College Prep. And then again, through these partnerships, students are able to explore different areas of healthcare and gain valuable experience at an early stage. So at this time, our CTK students are working with the infection control team at UIHealth. So they're able to take on some pretty cool projects in addition to their volunteer activities. Next slide. So CTK Work Study Program, we launched it in 2024. It is one of our newest partnerships. So far, we've had 4 students per cohort, and it is typically 2 juniors and 2 seniors. Next slide, please. ITW, David Spear Academy, is a volunteer internship, and this has been one of our longest partnerships. We've been in partnership with them since 2018. And we typically have around 2 to 8 students. Last year we had 8 students. This year we just started back again with ITW, and we have, I believe, 5 interns on site now.
Yeah.
Next slide, please. Oh, I'm going to pass this on to Pamela.
Okay. So our path to academic, community and employment, PACE internship. PACE is a 3-year post-secondary certificate program designed to meet the transitional needs for young adults with multiple intellectual, learning, and developmental disabilities. This is a partnership with National Louis University. Through this internship, it allows our interns to gain early exposure to healthcare careers through volunteering opportunities, but also develop their employment skills while giving back to the community. Our partnership with National Louis has been happening since 2021. We have had about 5 cohorts in the past years with them. Our success story is Jackson Casimis, who was hired immediately upon completion in 2022 at UIHealth in our volunteering services department as a HR front desk specialist. And then I am going to pass it over to Leslie to talk more about this.
Awesome.
Our newest addition.
Yes, our newest edition is North Londo Employment Network, known as NLEN. It is a work study program. Pamela, can we go to the previous slide? There we go. Oh, it's where we support individuals from underrepresented communities by providing a paid volunteer opportunity that reduces unemployment, serves as a first step towards a meaningful healthcare career, and uplifts the community. Next slide, please.
So we are partnering with a provider that actually our students, our participants are getting paid for their volunteer hours here at UIHealth. While they're volunteering, they're being exposed to a lot of employment opportunities and so forth. And we can also provide recommendations and so forth. So we're trying to kind of, yeah.
Yes, and then again, this is with North Londo Employment Network. So we recently launched this new partnership.
As of September.
As of September, yes. So we had our fall cohort with 5 participants, and at this time, we are preparing for the spring cohort, which we are very excited to continue our partnership. And again, all of these volunteers are coming from the North Londo community neighborhood. We also host professional development workshops that are focused on preparing participants to successfully enter and advance into the healthcare workforce. So we host monthly workshops centered on essential career skills. This includes resume building, interview preparation, networking strategies, job application navigation, and one-on-one mentorship sessions. We also work very closely with our human resources recruiters. And we're able to assist our volunteers again with the job application navigation.
So there's a lot of hand holding. We are able to provide that. Sometimes our volunteers think that their resume is presentable, yet it needs a lot of tweaking and a lot of molding. So we just want to make sure that we help them up to be prepared the best they can be.
Next slide, please. And then our goal is to continue empowering volunteers into healthcare careers. So over the past decades, the Volunteer Services Department has become a key player in providing entry into the hospital and university system by promoting professional development for almost 400 volunteers. Many of our volunteers have transitioned into full-time UIHealth employees, showcasing the strength and reliability of this workforce pathway. The Volunteer Services Office is also committed to hiring within our own volunteer pool. This practice aligns with our mission to create career opportunities for those who have shown dedication to our organization. And then many of our volunteers have begun their journey as an extra help support associates and have successfully transitioned into program coordinators, demonstrating potential growth and career advancement within our team.
Mm-hmm. And we're going to go to examples.
Yes, some of our success stories. We can continue with the next slide. So we have Nicole Disick. She started as a UIHealth volunteer in 2018 and became our clinical rotations coordinator here at UIHealth on February 2024. Manpreet Bala started as a UIHealth volunteer in 2017 and joined our volunteer services office as a program coordinator in 2021. In November of 2025, which was very recent, she became our program manager here at our office.
Yes.
Next slide, please. I will pass this on to Pamela for her introduction.
Hi, everyone. So a little bit about my journey here at UIHealth. I became a UIHealth volunteer since 2020. I was actually a high school senior, and I was able to become a volunteer through the UIHealth Champions program. And so I applied to become a volunteer, and then I was offered a job as a office specialist in 2021, while also completing my undergrad degree in public health at Loyola University. And then I became recently a program coordinator in November of 2025. And then, am I able, are you, Does my mic sound good?
And Pamela, we have one question in the chat
Oh,
from Vanessa Anzo.
yes.
Do the high school volunteers volunteer during or after school hours? Could you share, since you were a high school student when you were volunteering? So how were you kind of able to manage volunteering in your high school
Yeah.
between? Mhm.
So actually, I volunteered a lot. It was during the 2020 year, so during the pandemic year. So during that time, I was doing online school, and so much of the time I had free time, and I would use that free time to volunteer here in the hospital. And so I volunteered a lot during my
Every
free time.
assignment that we send out, Pamela was the first one to sign
Yes.
up. So that was very cute.
Yes.
And just to mention, there's a lot of we are very flexible with our high school students. So they can make up their hours during the winter break, during the spring break, during the summertime. So as long as they're communicating with us, we are super, super flexible. So usually they can do after classes, they can do weekends. So we are super, super flexible. And Leslie, do you want to share your story?
Yes, so I started as a UIHealth volunteer in 2023, and in 2024, I joined the Volunteer Services Office Administrative Internship. This internship focuses on the onboarding for our volunteers. So I worked very closely with our now program manager, Manpreet Bala, and I assisted with the onboarding process. I held the on-site orientations. And then last year, around this time in 2025, I began my office support associate full-time job position. And in August 2025, I became the workforce development program coordinator here at UIHealth. Next slide. So a few more success stories that we have from our team. Shania Cordon also started as a UIHealth volunteer in 2023. In 2025, she joined the administrative office internship here at UIHealth Volunteer Services. And in July of 2025, she joined as an office support associate. She's currently studying for her MCAT. While working as an office support associate. Moving on to Katie Chen. Katie started as a volunteer in 2022. She joined our 2024 CNA cohort, completed her exam. I believe she's also on the pre-med track. But in the summer of 2025, so very recently, she joined also our office support associate position.
She joined in, you said summer. She just joined in December.
December 2025. I'm sorry. Last month.
Newest addition to the team.
Newest addition. Next slide, please. Awesome. So as we look ahead, our goal is clear to continue expanding our training programs based on the hospital needs, growing our youth engagement efforts, and continuing building a sustainable pathway into healthcare careers. Next slide. If you want to learn a little bit more about UIHealth Volunteer Services, if you want to see a few of our pictures or some of our special events,
day-to-day activities,
any day-to-day activities, please feel free to follow us on our social media accounts. If you are interested in learning more about our volunteer requirements or our volunteer application, we also have a QR code linked below, and you can also find our email and phone number in case you need to contact us.
And we are open right now to all the questions that you may have. I know that Candace Brown asked which department and how many staff members run this program. So we have tons of departments that we are working with. So I have 7 staff members total. And we are working with different departments. So I have program coordinators, for example, in NICU, when we have baby toddlers, I have a program coordinator for volunteers over there. I have, so each department has their on-site contact person that's oversees volunteers directly, right? So, and I feel like also the beauty of our program is that volunteers can be assigned to different programs, which gives them a little bit of variety. They can work with kids, they can work with rehab, they can be in emergency room, they can greet patients, and on top of it, we have tons of different events in the hospital. So, any nursing events, any appreciation events, any holiday events. So, I mean, you name it. So also that's staffed by our volunteers. Any other questions that you guys have? Feel free to unmute yourself and just ask the question. What are the required skills for volunteers and what are the enrollment requirements? So the required skills, I feel we just want to make sure that our volunteers, we share it, we are asking our volunteers, why do they want to volunteer? We just want to make sure that, their attitude is in the right place, right? So we just want to make sure that they're kind. And so that's, I would say, and helping and willing to, be reassigned to different areas according to the need. So I feel like we do not have specific requirements as long as, their heart is in the right place, that, they are here to help others. And that's what we care. We can work around anything else, whether they're on a wheelchair or not, they have some disabilities, we can work around that as long as they have the right intentions and yeah. And the compliance requirement, Pamela, do you want to talk about that?
Yes, we do ask volunteers to complete a health screening requirement. So that means submitting specific vaccination records and something that we will outline more as they get as volunteers start their onboarding process. We also have volunteers complete a background check. And then once that is completed, we will have volunteers come on site to complete their on-site orientation.
So yes, background check and then the health screening. And Victor Vizueta has a question. Are you open to volunteers that are part of special populations, Spanish speakers? Sí, hablamos español y hablamos muchos lenguajes. So we are a team of tons of different languages. I think within our team, we have like so many nationalities, and absolutely. And another beautiful thing about our diversity is that, for example, when we have a patient in the hospital, that we had this patient from Lebanese patient, that he was very scared what was happening to him because of the injury that he had, and nobody's speaking his language. I got a request from the nursing team. Hey, Kinga, do you have any volunteers that they speak that language? I reached out to my volunteers, and one of our volunteers, the one on the wheelchair, Hannah, our hero, she was visiting the patient, and you could tell the difference between, it's like a day and night. When he was admitted to the hospital, he had this blanket covered, he was covering his face in a blanket because that's how scared he was. Hannah was visiting him on a weekly basis, and then he would talk. He came out of his shell. It was just so beautiful to see. So we have tons of different languages, and we definitely tap into those skills as well, because we have tons of different patients in the hospital. So yes, yes, and yes, that's the answer. We have recently implemented a volunteer program. However, some of the barriers we are having is students wanting to volunteer on the weekends. Management is not here on the weekends. How do you train those volunteers if management is not available? Or how do you accommodate those barriers? So just depending what programs those are, because hospital never closes, right? So we always have it's always good to have those point of contacts with people on site. So I would definitely reach out to that particular department and find out who is on staff. available during the weekends. And also, it's very important when you work with different departments, it's always good to kind of do some incentives for them. We have Volunteer Appreciation Week, and then we do a lot of fun stuff for our volunteers, as well as those program coordinators that they are actually on site with volunteers. That's why it's like a little token of appreciation goes a long way, right? What parameters do we set for shadowing when in different departments? Pamela, do you want to touch base on this because you've been working with that? That's the last question from Janine. Janine Sergey.
Okay. For shadowing, it really depends on the department and what type of shadowing opportunity the student is doing. So if the student is opting in for a 1 day type of shadowing, then the requirements are less. There are less requirements in regards to like their health screening and completing a background check. Just because that is also required for students shadowing. But if they're doing more than 10 days, we do ask for more requirements, but it really does also depend on the department.
I know I hear from a lot of others that it's hard to determine like what a volunteer or what, a student who's shadowing is allowed to do versus not allowed to do. Perhaps difficult to help department leaders find tasks that they're comfortable allowing volunteers to do. How have you navigated some of that?
So because we have representatives from different at different hospitals because we are a union hospital, so we have different requirements than Rush. For example, in Rush, their volunteers can wheel the patients. Here, we cannot wheel the patient. So you have to make sure that you are following all the little things, all the policies, and I'm not sure. I know that each hospital has different regulations. So, for example, that's the difference between our volunteers cannot wheel patients. Because that takes away the job from the transporters, right? And that's where we get in trouble. So our volunteers can assist in anything. There's a lot of daunting tasks in all the offices that our nurses need to do. For example, in surgical services, I talked to the director of surgical services and says, Kinga, my nurses, they absolutely hate putting the folders together with all the information for the surgeries. They cannot stand this. Like, guess what? I got you. We have volunteers that will be happy to help you. And we have volunteers that they are serving, they putting folders together. The same thing with patients that they're coming to emergency room department. Someone came up with this great idea with the folders with tons of inserts, but someone has to put it together. So that's what we're doing. And sometimes as a volunteer, you have a day that you want to be facing patients, and sometimes maybe you are so swamped with your school that you want to listen to your lecture or just watch a movie in front of you and assemble folders, right? So that's why we providing that kind of variety of stuff, it's good. And then they can volunteer in different places, which is not too boring for them because in one day they can work with kids, they can work in emergency department, they can work with cuddling babies, they can watch the therapist in their rehabilitations, or they can help out with the event. So I'm sure, for example, in the craniofacial center, there is 75 years data. It was literally files on top of files, 75 years worth of files. We had volunteers for 3 years, Monday to Friday. They were scanning everything to the system. It took them 3 years, but we did it. And now can you imagine you pay your nurses to do that instead of them actually taking care of the patients? So it's also, yeah. So we always find ways to, and I can guarantee you that there are tasks for volunteers to do. You just need to look for them.
Hello.
Hi, Thelma.
Hi. So I just wanted to introduce myself. I'm Thelma LOB from Rush University Medical Center Volunteer Program. And
Beautiful.
And it's a pleasure to be on this call to just hear about your program and learning about the great things that you guys are doing and also some of the similarities.
Good.
So, one of the things I'm just kind of hanging back, just kind of watching, just kind of listening, kind of learning. So, we do have a program similar to you guys. We do support the PACE program. I do have two PACE students. The PACE
Beautiful.
program has been part of Rush maybe for the last 15 years. We
Beautiful.
also have the Cutler program. We also have Rush Generations. This particular program is for our seniors. We do have a help program. We just launched maybe in 2023, we launched a HELP program, and the HELP program stands for Hospital Elderly Life Program. And those HELP volunteers supports the nurses with patients that suffers from mobility, delirium, things of that nature. So it's a phenomenal program, and like I said, not many hospitals in Illinois or Chicago has that help program. So it's great to be part of that. Our onboarding process is similar. So they do have to go through a background check. They do have to meet medical requirements, immunization records, current TB tests, and they do have to do the mandatory modules. Yep, I didn't hear you all say that. So I just wanted to jump on just to say hello and let you guys know
Thank you so much,
the rush
Thelma.
is
That means a
here.
lot.
Yeah, you're welcome.
And we are neighboring partners here. So
Yeah,
yeah,
so I do have some of
Yes,
your UIC students. I got some UIC students down here.
beautiful.
Yep.
that's
Thanks so much
awesome.
for joining, Thelma. And I know Vanessa at St. Anthony's is with the volunteer services. I know, Northwestern runs deep, so I'm sure someone here has something to do with volunteer services. I just want to throw it out there that Chicagoland Healthcare Workforce Collaborative is here to be a peer learning space. If you all would be interested in doing something like gathering in person as volunteer services leaders to just, share notes and resources, I'm happy to facilitate that or anything similar to that for everyone on this call. So just let me know if you have ideas. And maybe
Thank you so much,
we'll
April, for connecting us and for the opportunity. We're always happy to help each other. Absolutely.
And the reason I asked you to do this, Kinga, is I'd already known how impressive your volunteer services program was, but when we had an employer peer learning session for all of our employers, our workforce teams, whether they be volunteer services or talent acquisition or whomever, to come together and talk about what's really working with your workforce initiatives, everyone said, "Oh my gosh, Kinga, that is impressive. We need to learn more." So that was the impetus to inviting Kinga to give this highlight today. Please, everyone, continue to ask me for what you want to hear from each other. And with that, we're about at time. Thank you so much, Kinga, for putting together this
You're welcome.
presentation and sharing all of your amazing success. Thank you, Pamela and Leslie, for joining. Kudos to both of you. Pamela, I think you spent your pandemic time in a much more productive, generous way than a lot of us did. Thank you. And frankly, you all have made me think about maybe I need to join the UI volunteer services
Oh,
team as well. So thank you so
we'd
much
love
for
to have
this.
you.
I appreciate it. Thank you all for being here. I will send out the recording and the slides tomorrow. Thank you all. And stay warm out there.
This was great, April. This is Annette. This was great hearing that there's so many volunteer opportunities that we can share with the prospective students that we're working with. And that's another way for them to get experience and work their way in the door to see what they really want to do. So this was really great. Thank you so
That's
much.
awesome.
You're
Thanks you for
welcome.
joining, Annette. And actually, yeah, I'd love to include just like the link directly to the volunteer application
Yeah,
in
it's
our
right here.
follow-ups.
Yeah.
Excellent. All right. And thank you. Thank you so much again. Everyone have a great day.
Thank you
Appreciate
so
you.
Thank
much for
you.
having us.
Of course.
Have a great day.
Thank you,
Bye-bye.
April.